Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Zamfara state government takes delivery of medical consumables from the Foreign Commonwealth Development Office to help contain the coronavirus. Taraba state government cites pandemic as reason for not implementing workers' minimum wage yet. And more than 70 MPs launch campaign opposing COVID passports in England amid reports of pilots to test how they would work. Christians around the world are marking Good Friday with worship centers open to limited numbers of faithful. In Nigeria, the second annual Holy Week is taking place under the coronavirus protocols to help contain the spread of the virus. In the meantime, the Nigeria Center for Disease Control, NCDC, confirmed 106 new cases of COVID-19 yesterday across 12 states, including the Federal Capital Territory. Lagos, the epicenter of the infections in Nigeria, reported 33 cases, followed by the FCT 20 and Cross River 11. Other states with new cases include Rivers 11 as well, Kaduna 7, Edo 6, 6 in Ondo, 3 were recorded in Nasarawa and Ogun States, 2 in Kano, Bauchi, and another 2 in Osun State. According to the NCDC, 60 people recovered from the infection on Thursday, but 1 death was recorded from COVID-19 complications, bringing the number of fatalities in the country to 2,058. To date, 162,997 COVID-19 cases have been confirmed in Nigeria, with over 151,000 recoveries. In the meantime, as the Easter holiday kicks in this weekend, the World Health Organization and the Africa Center for Disease Control is warning of a coronavirus surge, asking people to protect themselves, whether vaccinated or not, to stop the spread of infections. Meanwhile, the vaccination rollout across the country continues, with Nigeria vaccinating more than 800,000 with Oxford AstraZeneca COVID-19 vaccine within 3 weeks. The National Primary Healthcare Development Agency, which continues to lead the rollout with a breakdown of data from the 36 states and the FCT, with only Kogi State, which has no data. Now, states like Bauchi, Ekiti, Kwara, Ogun, Ondo are reaching higher targets of above 80% compared to other states like Abia and Taraba states, with the lowest numbers. Now, Lagos, the epicenter, however, has vaccinated over 150,000 persons with the first dose of the AZ vaccine. According to the DG of the Primary Health Care, Dr. Faisal Shoaib, if you experience any side effect following COVID-19 vaccination, you are to report your vaccination site immediately or get in touch with your physician. In a tweet by the DG and CDC, if you have gotten the first dose of the AstraZeneca vaccine, it says do not let your guard down. You are not fully vaccinated until 15 days after the second dose. And persons who have recovered from COVID-19, the Ministry of Health is advising that indeed you can also take the vaccine. Well, joining us from Abuja studio, Dr. Hassan Sule. He's a public health physician. He joins us for more on the vaccination campaigns across the country. Welcome to the program.
Oh, thank you for having me.
All right, Dr. Sule, what's your take on the progress of vaccinations in Nigeria?
Well, by and large, I think the subscribers to it, the numbers that have been subscribing to it have been positive, I think, encouraging.
States are reporting their updates. Okay.
I've seen more people than I've expected to going for it. And these people are representative of almost every class of society. People who you call enlightened, and then those who you call not very enlightened. But in my opinion, the uptake has been good.
States are reporting their updates, as we can see, but some faster than others. And in some places, some reasons are given that some health workers are also hesitating to take the vaccines.
Well, yeah, that response will be typical because there were a lot of voices speaking during the COVID pandemic. So naturally, you'd expect people to hold back, a significant number of people to hold back. But I think the first people who went for it were health workers. So we could look at the glass as half full or as half empty. But I think I choose to look at it as half full. And if you look at the states where the epicenters of the pandemic, like Lagos, for example, the uptake has been really good, really encouraging. Just a little over 150,000 people have taken the vaccines, and I'm sure a good number of this would go for the second and third doses. Yes, but it is also concerning that there is hesitation towards the vaccine, and that is not something that cannot go away with proper enlightenment, more done in the area of enlightenment. And if people begin to see testimonials of people who have taken the vaccines and come out okay, I think would be a lot more people would let their guards down and subscribe to it as well.
So finally, let's take a look at supplies. Only yesterday, the Africa CDC expressed fears of the wave in India and how Africa is unlikely to meet its targets for vaccinating the continent against COVID-19 if there are supply delays from the Indian manufacturer. This definitely threatens Nigeria, doesn't it?
Yes, it does. Seeing as it is that we're getting our supply from India, who would want to serve their local population first before looking outward. That's sad to say. However, the numbers that we have at least would go for a first round. Yes, that stalling of supply would affect us. We just have to hope that the spike in India doesn't end up requiring more vaccines than would hamper supply to other parts of the world.
We appreciate your time.
As it is, we're in competition. All right. Thank you very much.
No. Finish with what you were going to say.
Yes. As it is, we're in competition with some countries in Europe for the AstraZeneca vaccine as well. So a shortening of the supply, I mean, there'll just be sort of a vaccine warfare. I hope it doesn't get to that point.
All right. Thank you so much. Dr. Hassan Sule, public health physician. Thank you for joining us on the program.
My pleasure.
The Foreign Commonwealth Development Office Health Project Lafayette program has donated personal protective equipment, PPEs and other medical consumables to Zamfara State to support the COVID-19 response in the state. The coordinator of the program in the state disclosed this in Gusau at the end of the meeting.
Zamfara State, since the outbreak of the coronavirus, has been one of the lowest hit in the country, recording over 200 COVID-19 infections and 8 deaths. Yet, there are more efforts on the way to ensure the reduction and elimination of community transmission in the state. A health project tagged the Lafayette program by the Foreign Commonwealth Development Office is donating items such as 1,553 pieces of face shields, 9,317 examination gloves, 12,063 medical masks, 18,634 hand sanitizers, 62,112 surgical gloves and others to support the COVID-19 response. According to the program coordinator, many activities are ongoing to build capacity for health workers to support in community engagement and conduct of COVID-19 testing.
So the objectives of the support, as it contained in the concept note, is 1, to support the COVID-19 response in Lafia targeted states and at national level, including flexing to other states where the need is greatest. Number 2 is to support the continuity and access to essential primary healthcare services. And 3 is to support the central role of health workforce in the response.
Meanwhile, commending the program, the Zamfara State Commissioner for Health noted the contribution of the Lafia program at this time, appealing for an extension.
You can't start breastfeeding and stop if you don't want your child to die. You see, and to me, it's not closing. I'm soliciting from the coordinator and his lieutenant and crew members who are our partners that make this ministry to be what it is today. All Progress and other charity groups, I think, is by your own support that we become one. We just have to start the war or the race. If it takes us to war, you will not go. You will not leave.
While the coronavirus rages, Zamfara State moves ahead to fortify its frontline workers and ensure healthcare delivery for the citizens of the state. Zamfara State also continues its vaccination drive, administering over 9,000 doses of the Oxford AstraZeneca vaccine.
Civil servants in Taraba State may have to wait a little longer for the new national minimum wage, pending when the state's economy recovers from the burden placed on it by the outbreak of COVID-19. The state's head of service, Susie Nathan, disclosed this to journalists in Jalingo while reacting to the indefinite strike action embarked by civil servants there.
I want to say that we have been having a series of meetings with labor leaders. And even the first and the second meeting, we told them that they should be patient and they should consider the fact that COVID-19 pandemic has placed a burden on the economy of the world, including Taraba. And in due time, when things have become a bit okay, that they can be paid the minimum wage. However, we are looking into it. But I just want to emphasize this point that His Excellency, the Executive Governor of Taraba State, Architect Darius Dixon Ishaku, is not insensitive to their demands. I want to state here categorically clear that His Excellency is so passionate about the welfare of the civil servants of Taraba and other workers, and I'm sure he will definitely grant their demands when it is convenient for him.
We have more when we return. Please stay with us. Let's now take a look at the impact of strike on the vaccination process in Taraba. Dr. Minu Jauro, Executive Secretary, Primary Development, Healthcare Development Agency, also a community health specialist. He joins us via Zoom from Yola. Thank you for joining us on the program.
Yeah, thank you very much for having me.
First, what is the strike's impact on the ongoing vaccination exercise in the States? Because now it seems that there are two strikes, that of the civil servants and then the Nigeria Association of Resident Doctors.
Well, thank you very much. I want to believe the head of service of the strike action, but I also want to say there's one strike too many to bear. And indeed, the strike has seriously affected our efforts in trying to ensure that we reach the eligible people with the required Oxford AstraZeneca vaccine as been prescribed globally. But be it as may be, we are making concerted effort as an agency through the State Ministry of Health and indeed with other key stakeholders to ensure that the strike action doesn't hamper our reaching out to ensure that we vaccinate 50% of our eligible population that are within the reach of the frontline health workers. Surprisingly, most of the health workers that are supposed to benefit from this vaccination are among those that are embarked on this strike as a result of the Labour Congress initiation of that strike action. And I want to believe the resident doctors that have also joined the strike yesterday have also different demands, which, as the head of service rightly said, will definitely be attended to by the government of the day. And I know His Excellency, the Executive Governor, is so passionate about that, and he is definitely going to do something about that. But by and large, it has seriously affected the turnover of the number of targets that we want to reach, because we are supposed to vaccinate not less than 28,130 people with Zeneca vaccine. But as I'm speaking to you now, with the ongoing strike, Taraba State, we are only able to vaccinate just more than 10,000 only.
And indeed, this also speaks to the numbers we're seeing, that Taraba, just like just a few other states, are lagging behind in what we know. But then also the plans to complete the second doses before the 12-week window is also another race that I believe a lot of states need to take into consideration amid the strike action. But in terms of the infection spread of the virus, how would you say that the worst is over in Taraba State?
Well, it's already over because we have to term the spread of coronavirus globally, not only in Taraba State. But I want to believe the Taraba State government have done so much in trying to ensure that it creates the required awareness, and it gives both the Ministry of Health and indeed the State Primary Care Development Agency the enabling environment to ensure that at least we do what is needful of us, which includes, among others, ensuring that at least we create ample opportunity for people to know exactly the effects of the pandemic, which is globally bedeviling the whole of the world. And apart from that, we have also, as an agency, continued to engage with our people at the local government level, the town announcers, the village health workers, the ward development committees, to ensure that they continue to propagate the principle of social distancing, using the face masks, hand washing, use of hand sanitizer, and then the social distancing as part of very stem measures that will help to stem the tide. But having said that, another factor that is key is the coronavirus vaccination, which is very, very important. But as you are aware, the phases of the vaccination are classified into 4. The first phase is meant purposely to target frontline health workers who are the receiving end of attending to clients, patients in the health facilities, general hospitals, and what have you. And if we're unable to get 100% of them, 50% of them vaccinated, then it means so much is left to be desired. But I want to believe, before the week runs out, definitely that strike, as the head of service rightly observed, will be a thing of the past. But with even the strike action ongoing, we have succeeded in at least discussing with the critical stakeholders at the local government level, under the auspices of His Excellency, the Deputy Governor, putting calls and above all inviting the local government Algon chairman and others to ensure that this exercise took place in their locality. And I want to announce to you that that has been done. Most of the local government, apart from only 1 or 2, are still ongoing with the vaccination exercise. And I want to believe we'll continue doing that until we get our target of 28,000, which is 50% of the total number of vaccines given to us, which is 56,250. And we have work plans already on ground for the second dose, because the vaccine that was given to us is not for only the first dose. It is to cover both the first dose and the second dose.
First and second. All right. We'll continue to keep tabs on those updates. We appreciate your time for joining us. Aminu Jaro Hassan, Community Health Specialist, also Executive Secretary, Primary Healthcare Development Agency in Taraba. Thank you for joining us.
Thank you very much.
The Lagos State Safety Commission is asking residents to visit any of the designated centres and get vaccinated. The Director General of the State Safety Commission, Mr. Lanre Mojola, says the COVID-19 vaccine is safe for all. He was speaking at Alausa. He also informed the public about the World Safety Day, which is targeted at creating awareness on how to prepare ahead of unforeseen circumstances.
This year's topic is titled Anticipate, Prepare, and Respond to Crisis. Invest now in resilient occupational safety and health systems. As you're aware, we've recently undergone a pandemic over the last 18 months, thereabout, across the world. It was something that no one expected. And going forward, as health and safety practitioners, we need to now ensure that we're not caught unawares. The vaccinations are handled by a division under the Ministry of Health, under the Federal Ministry of Health. And what our remit and our mandate is to continue to encourage people to go out, once they qualify for these vaccinations, to get these vaccinations. These vaccinations are absolutely safe. They've been approved by the WHO, they've been approved by several health institutions across the world. So they're safe. They're not anything anybody should be scared of getting.
And to the international scene, Kenya, Pakistan, Bangladesh and the Philippines are being added to England's travel ban red list, which means that travellers from those countries will be banned from entering England from the 9th of April. We also hear that the coronavirus reproduction number or R value in England is between 0.8 and 1. Latest figures are showing. Last week, the whole of the UK had an estimated R figure of between 0.7 and 0.9. Also, there is another 59 deaths within 28 days of a positive coronavirus test, which has been recorded in the UK. And this is coming as more than 70 MPs have launched a campaign opposing COVID passports in England amid reports of pilots to test how they would work. Now, as March came to an end, the numbers came in, and in Australia, there had been over 670,000 COVID-19 vaccinations. These numbers fall far short of the original 4 million goal set by the coalition and puts revised goals in doubt. So let's speak to a medical doctor about the challenges. And we have joining us Dr. Oluwadamilola Obawede, a postgraduate researcher at Monash University. She joins us from Melbourne, Australia. Thank you for joining us on the program.
Thank you for having me.
All right, first, tell us about the sort of model that Australia is using to bring its infections down.
Okay, thank you. I would say that Australia has done a really good job at curbing this infection. I would say it stems from a set of strategies that have been implemented. First of all, they ultimately, they have made sure that things do not get worsened before they take action. For example, we get snap lockdowns. In a case where some cases are detected, we just go into immediate lockdown. And Australians are really obedient. So if they say wear your mask, everyone goes around with their masks. Everyone observes social distancing. Another thing is contact tracing. Most locations now, like most buildings, if you're going into them, you have to scan a barcode where you have to put in your details, like your phone number, your email address. And with that, they've been using it to trace cases. So if they detect a new case, they end up contacting people and everyone gets tested to be sure that they are safe, and they also isolate. Lastly, I would say closing the international border. This may have felt really harsh to a lot of people, but the fact that it has really been effective because it has prevented cases from overseas from coming into Australia. And even the people that have come into Australia, they have been made to undergo hotel quarantine, so they are not able to go back home to get to do their isolation. They have to stay in a hotel to get quarantined, and after 14 days, they get tested before being released into the community. So I feel like these are just a few strategies that Australia has taken.
All right, we're wrapping up the show now. In just a few seconds, the vaccination started out in good time, but what went wrong with the rollout?
Well, in my opinion, I do not think the vaccination started in good time, because the first set of doses that arrived like on the 12th of February. And at that time, a lot of countries have gone far in vaccinating people. So besides that, Australia has had a very relaxed approach in vaccinating people because we really haven't had high death rates. Our cases have reduced. As at today, we have about 159 active cases in the whole of Australia. So that has made it to not seem like an urgent thing. Like the Federal Minister of Health, Greg Hunt, said that this vaccination is going to be a marathon, not a sprint. So we can clearly see that there is just no sense of urgency.
All right. Well, I'd like to thank you, Dr. Oluwadamilola Obawede, a postgraduate researcher with Monash University, Australia. Thank you for joining us on the program.
Thank you for having me.
Thanks so much. Now, as we enter the holidays, continue to adhere to the non-pharmaceutical interventions and other public health guidelines. Visit our website for more updates, a better understanding of the pandemic. It's channelstv.com. That's the program. Thank you for watching. I'm Millicent Onwoka. Stay healthy, stay safe.